right, I forgot they told me about you guys today. You're just in time. I'm a new CNL today, and I got a new patient coming in for this Cochrane review for this sickle cell study. Come on, let's go see this new patient.
Come in.
Hi, I'm Elizabeth, the CNL today.
I'm sorry, why are all these cameras here?
Oh, don't worry about them. You know, it's just a part of the job. My name is Elizabeth, and I am a clinical nurse leader for our pediatric sickle cell program. And I help families understand the evidence behind our care plans and for sickle cell treatment.
Okay, awesome. My name's Leah. I'm here for my son.
Can you tell me a little bit about it?
Yes, he's 2.5 years old, and he has a diagnosis of sickle cell disease, and we want to make sure that he's staying safe.
Okay. Well, before we jump into recommendations, I want to explain how we make these decisions. We use something called a Cochrane review, basically the fiance of medical evidence.
Oh, okay. Is it trustworthy?
Absolutely. Cochrane reviews search every major medical database. They include only randomized or quasi-randomized trials, have independent reviews checking the data, evaluate risk of bias, and they use a grading system called GRADE to rate evidence quality.
Sounds pretty thorough.
We just got done talking about the Cochrane review. It's like Dwight Schrute invading your whole medical history and auditing it. It's very intense, invasive, and terrifying. Kids with sickle cell disease, especially infants and toddlers, are really vulnerable to pneumococcal infections. One big study found an evidence rate of 10 pneumococcal infection cases per 100 persons a year in kids under 3 years of age. And vaccines don't work super well in this age group, so the review looked at whether prophylactic penicillin could help prevent these infections. Oops.
Okay, so what exactly did this review study?
Let me break it down using PICO. A structured clinical question, P standing for population, children with sickle cell disease, including HBSS, which is a certain gene that the child gets, sickle cell beta thalassemia, HBSC, which is hemoglobin, if you didn't know, HB stands for hemoglobin, and also infants and young children under 5.
Okay.
And I stands for interventions, which is the prophylactic penicillin, which is a regular antibiotic therapy. C is for comparison, which would be the actual antibody or the placebo. O is for outcome, which is the pneumococcal infection, mortality, adverse events, antibiotic resistance, compliance to the antibody, nausea, vomiting, and when it's safe to discontinue, your doctor will let you know if you can stop at a certain point or if you need to continue that prophylaxis therapy.
Okay, that's making a little more sense. I should have brought a notepad for all of this.
So here's what the review found. And this is the part that matters the most for your son.
Okay.
Penicillin significantly reduces pneumococcal infections. All 3 trials included that and showed that reduced infection rates in kids receiving penicillin worked. In fact, that the odds ratio for preventing penicillin was 0.37, meaning penicillin cut the risk by more than half in all the children that received the prophylactic penicillin. And it is safe to stop at age 5. One trial looked at withdrawing and found that an odds ratio of 0.49, meaning no significant increase in infection when stopping at age 5. Adverse effects were rare and minor, mostly mild. GI symptoms were the most common side effects. And compliance is always the most challenging issue when you have small children. kids missing doses is the most common issue when you have to try to give them something every day. But routine is the most important thing to follow.
Okay.
Evidence quality was low because of bias, allocation of concealment issues, and small sample size. So it would always be best to have a larger sample size, but sometimes you just can't.
Okay, so let me get this straight. This is going to be safe and effective for my son.
Exactly, and easy to take.
So what's next?
So my role as the clinical nurse leader is to translate evidence into practice. This means creating protocols based on the Cochrane review, ensuring every eligible child receives prophylactic penicillin, and training the staff, monitoring adherence and outcomes, and making sure care is safe, high quality, and cost effective, which is a most high concern for a lot of parents.
Okay, I've never met a CNL before, so thank you for explaining that.
Oh, no problem. This is literally CNL Essential 4 and Competency 1. My professor would be so proud. I also share this evidence with different groups, which would be patients and families. We do that in simple language handouts, teach back methods, colleagues and staff meetings through protocols, policies, quick reference guides, flyers also, community partnerships with sickle cell organizations, health fairs, and social media posts, and parents. People like you.
Thank you. I appreciate that. I think everyone needs information in a way that they can understand.
Let's talk about your son specifically. He is a 2-year-old African-American male with hemoglobin SS, fully vaccinated, no severe infections, and no allergies. He matches the population studied.
So he matches the population studied. Okay, so what is penicillin?
It is a generic antibiotic used to prevent life-threatening infections in children with sickle cell disease.
Okay, how would he take it?
He can take it by mouth every day in like a syringe because he's small. You would just kind of put it in the side of his jaw and just insert it. You could do it with meals every day, like brushing teeth in the morning, but you might want to put something on his stomach first. You could do it with breakfast. Just make sure you're doing it at the same time where you would do it before bed. Just want to make sure you have a routine.
Okay. Is it expensive? Because if I'm doing it twice a day, that seems like it would cost a lot.
Usually it's between $4 to $10 with insurance, so it's not too expensive. It's manageable. So just to give you a little education, you want to give it at the same time every day. If he ever has a fever of 100.4, you want to call immediately. You don't want to wait. And keep up with all his vaccinations. Make sure you're getting those on time every month.
Okay, and we plan to do that.
Yes. But we strongly recommend that you give him the penicillin.
Okay.
Mm-hmm.
And if we're giving it for a while, when is he able to stop taking it?
We'll reassess him at around age 5 to see if his risks have dropped significantly for any infection. Because that's usually around the age where they have a good immune system and it can fight off most infections at a good rate. And vaccines usually start to space out at that time.
Okay. Well, thank you. That makes me feel a lot better. I think we're going to move forward with the penicillin.
Well, that's great to hear. We're here to support you. Give us a call. We're here every step of the way.
Awesome.
I think that went pretty well. I didn't cry. The parent didn't cry. The child didn't cry. And the cameraman, well, he cried a little bit.